TGH has converted to the new 39-inch HoverMat Link. You will be able to identify the new HoverMat Link by its clear green plastic package. The new HoverMat Link has eliminated the plastic buckles and replaced it with Velcro. It has also added anchors at the head and the feet, providing you the ability to anchor the mat to the bed or stretcher. These changes only apply to the 39-inch HoverMat. The 50-inch bariatric HoverMat will remain the same. The anchors are available in the side green pockets located at the four corners of the mat. When anchoring the mat to the foot end of the bed, you may anchor it either on the bed frame or the footboard. However, when anchoring it at the head end of the bed, please anchor it on the bed frame only. Do not anchor the mat on the headboard. Anchoring the mat to the headboard will prevent the head of the bed to be elevated. Anchoring the mat will prevent the mat from being displaced underneath the patient, will enhance skin integrity, and maximize patient safety. Please remember to detach the straps prior to boosting the patient up in bed or transferring the patient. And remember to always inflate the HoverMat when moving a patient on a HoverMat. Always get into position of safety prior to inflation and deflation of the HoverMat. Please use the adjustable rate inflation. Please remember to stop, lock, and look when using a HoverMat. SPD carries both size mat, and the new HoverMat Link item number remains the same, 112191.